Carol. Come on up, Carol Smith.
Hello. I've got a more serious topic. I'm going to be talking about figuring out how to treat cancer in sub-Saharan Africa. I was selected to be part of the IBM Health Corps last fall, and we had to work on solving this problem. People in these countries in sub-Saharan Africa really have issues getting to treatment, and part of that is because of the travel and just logistics are difficult. So time is very relative there. With travel being so difficult, you would make an appointment with a physician for a Tuesday, not a particular time, but an actual day. And you'd arrive when you could, and then you would be seen when you in queue. And so these challenges really build upon themselves. And luckily, people in sub-Saharan Africa are living longer. So we've taken care of malaria, we've taken care of HIV. A lot of these things are taken care of, and people are living long enough to get cancer. Not cool, but we can fix that. We can do things about that. And because manufacturing is more frequent, toxins are building up, lots of reasons for this to be happening. But again, there's solutions for this. And cancer in Africa does look different. A lot of people present very late. There's what the American Cancer Society calls a leaky pipeline. And that means that people aren't always diagnosed early. So there was a boy named Paul who had eye cancer, and initially he was given eye drops. No one recognized the symptoms of cancer, and so he wasn't given the proper diagnosis. And so these leaky pipelines continue where people don't get treatment. They are scared to get diagnosed because they think they'll die. Even if they get to the hospital, they cannot get the treatment that they need because it's not available. And that's what my team was there to do. We worked together very closely as a team, IBMers, and we worked together on this problem. How can we help this boy, Paul, get the treatment he needs? If he gets to the hospital, he should get the treatment he needs. It shouldn't be a barrier at that point. So that was what we did with the American Cancer Society. So we worked with specialists from these countries, from Uganda, from Kenya, from these various areas in sub-Saharan Africa, and talked to them about the problems they were having. We worked directly with them to really understand the issues, and this is design thinking. You heard this talked about a little bit earlier as well. And by doing this close conversations with these individuals, we were able to better understand the problem. And these individuals actually were able to come to meet us. We actually met in Washington, D.C. We worked together side by side for 3 weeks there. And this is Michelle, and she was one of the specialists who came to us. And she's working very closely with us, helping us to understand what are the challenges that these people are facing? Why are they having such issues getting treatment? What is going on with the forecasting of cancer treatments? And that's where we started to really tear this apart. So these are the cancer treatment guidelines for countries with lots of resources, like the United States. We needed to take it down a level for countries that have less resources. And so we took those guidelines and started to digest them and to look for the patterns between these different types of treatments. Where can we potentially purchase in larger amounts? Where can we start to help these countries forecast ahead, knowing pretty much how many diseases they're going to need to treat and what they can do to buy in bulk and save money? So I lived with these people for 3 weeks in a house. We were sequestered away from our daily lives so that we could really focus on this problem. We were all specialists in our various areas, and we brought our different skills together. We also celebrated things like a birthday together because we were stuck together, but it was a good stuck together. And we used agile methodologies. These are a software process where we literally take Post-it notes, write down what we're going to do, and then track it across. And we got a nice done pile when we were done. We got a lot done in those short 3 weeks. And so by tracking the work, we were able to really see what we were each working on, what was going on, and how much progress we were making. And what I did next was really take these ideas, these initial assumptions that we had, and drew them out. And then I showed them to the specialist. I showed them to Michelle and the other individuals and said, what do you think? And they gave us feedback, and then we iterated, and then I did more iterations, and I did clickable prototypes, all these different ideas coming together to come to a solution. Next, we had to do the data entry. So we all had to put away our specialties and type a lot. Putting this into Excel spreadsheets so that it could all be ingested into the system. And then they would be able to, again, see the pattern in the data, be able to buy treatments for treating cancer in bulk to save money. And so this is the final product. In 3 weeks, we built an entire system that was able to help them take an initial forecast, figure out what they would need, and then know what they needed to buy to get a shopping list so that they could then go and purchase these in bulk, save money, and treat the patients as they came to the hospital. And so the nurses would not any longer have to turn away a boy like Paul. They would not have to turn away patients who got through that pipeline. They got all the way through, they got all the way to the hospital, and they didn't get treatment because it was out. And that's a horrible thing. So that's what we are doing. We're stopping the leak in the pipeline. And by slowly backing up that pipeline, by first addressing the easy issue relatively, which is just the forecasting, let's make sure we have the right drugs at the right time. Next, we can then focus on a harder problem. So for example, diagnosis, and that's what we're gonna do next. We're going to be looking at how can we help these physicians to diagnose more quickly and to figure out what treatment is the right treatment to be giving to these patients so that they survive, so that they have more birthdays. And so that's our next challenge. And we're working together. We've got processes already. We've got Watson for Oncology, and that is a system that allows an oncologist to more clearly see what the options are. And that enables a physician who doesn't have experience in the wide range of cancers to be able to treat all kinds of cancers. So I'm actually heading back to Africa. I was there in April, and I'm going back in August to be able to really understand firsthand what's going on there and take that information and bring it back to the software development team so that we can make the right product. And in addition to that, we're continuing to work with the American Cancer Society, and they're gonna take this on forward. They're gonna keep working up that pipeline, helping people to identify symptoms, helping people to get to the treatment more quickly, and making sure that there are more birthdays so that patients win the fight against cancer.